First and foremost, we were not exposed to education on HIV/AIDS as nurses. As a member of AIDS Consortium, I've been trained on many issues like mother-to-child transmission. There have been people coming from overseas to give us the training and many other trainings and like basic facts on HIV/AIDS.
Whenever the HIV appears in our nursing medical books, if ever it was mentioned, would be at the end of the chapter, giving the impression that nothing could be done except TLC, which you heard about. I therefore now call on nurses, colleges and practical fields to restructure the curriculum and give HIV a room as to be able to monitor opportunistic infection effectively in an early years of being a student nurse. Of course, trying to remove an attitude of being a helpless professional nurse.
We here must make sure that we help nurses, that we produce counsellors, that we, in April, the month of volunteers, that every one of us make sure that our hospitals have a proper place for counselling in our communities.
It's high time that we take a stand up and correct what is happening in the public hospitals, because we need to subsidize those public hospitals in order for us to get a quality treatment.
The AIDS Consortium and our clinic were born at more or less the same time. And it was actually very useful to go there to start meeting people that I could network with. Because when we started the clinic, there wasn't all that much going on about HIV. There were one or two people who were working in it, and you didn't know where to turn. So it became a useful resource for referrals and for networking with other people. They're very useful for training, for education, for literature. Definitely very much a resource still.
A lot of patients have got HIV-related illnesses. At any given time, you find that in a ward, having 31 beds, you have got 25. At the average is 19, but these days we are having 25, almost every other day.
Stress on hospitals is phenomenal. We diagnose 80 to 90 patients per week in this hospital. We're a 512-bed large regional hospital. In addition to those patients per week, we readmit patients because they've come in for opportunistic illnesses and that sort of thing. So there's a large number of patients being admitted with HIV illnesses. Patients are discharged while they're still sick because there's such a pressure on the beds.
With the number of staff being reduced and the high prevalence of HIV/AIDS, which is also causing more strain on the nurses, people are not interested in their work anymore.
The nurses tend to become hard and they tend to treat the patients badly, and that's very unfortunate. Because of the large amount of stress that they've got, they become impatient with some of the patients and so on. I'd say to them, why are you here? You know what's wrong with you and that sort of thing. Instead of getting in there and helping them, they also have a very negative view of HIV because they haven't been trained. Very few nurses have had decent training on HIV. And they have a view that if we can't give antiretrovirals, there must be nothing that we can do. And they see sick patients coming in and they see the patients either dying or going out very sick. They never see the well patients. So the ward nurses are the ones that really have a major problem. They struggle.
There is very, very little support for nurses coming from the side of the employers, both in the public and the private sector. And most nurses, in particular, are suffering from stress because it is very, very hard to be a nurse in a hospital and looking on every day where HIV patients are not treated properly. That causes stress and mental, unhealth amongst nurses.
It really affects nursing care for you to come on duty when you know that there's nothing that you are going to give a patient. Access to treatment will make difference. What is the point of the patient lying in bed, getting food and the drips with no treatment? You become frustrated yourself.
Okay. We don't have antiretrovirals in the clinic, unfortunately. The government doesn't give us any, but we've got quite a lot of people who actually get antiretroviral treatment with the employers paying. And we've seen stunning results. Yeah. Patients who sort of moribund and just about dying, and we get them onto antiretroviral, and a couple of months later they bounce in, full of life, put on weight.
I stand in front of you today being a professional nurse and, of course, being proud of having to have a chance of being in a position to work with antiretrovirals. Not only it has made difference to the patient, but it has made a difference to myself as a health worker.
The availability of pre-treatment will be just part of the treatment for the patient. Because if they bring treatment, but there's no staff to give the treatment, still the treatment will be lying in the cupboards with nobody to provide the treatment. It's only 2 people taking care of these babies, and all these babies need intensive care. The nurses are not coping. The pressure of work has put a lot of stress on the nurses. And what is even worse is that nobody appreciates what the nurses are doing under the difficult conditions within which they find themselves in. A present scenario is that you find that one nurse, that is professional nurse, one nursing auxiliary, one ward attendant are attending to 60 patients. What type of service is that? We know how frustrated nurses are, doctors are. Where a patient comes, she's raped, she can't be given AZT because it is not provided. For that person to get AZT, she must go to the pharmacy outside. There's nothing like that in the hospital. A big hospital like Baragwanath, nevirapine that is provided in the hospital is not a hospital issue. It's provided by pediatric research unit. And very often you'll hear people talking about nevirapine in Baragwanath. That is a private entity. We need treatment. And those are some of the challenges that are facing nurses. You find nurses are demoralized. Why are they demoralized? You come to work, there's no treatment. You are working alone, you are just a piece of nervous wreck. We need to look at what are the basic needs for both the nurse and a patient for us to be able to provide the treatment.